So pleasure to have both of you here with us today. And Amy, actually, let's start with you because I can't believe it's been 5 years since you've had the surgeries.
Yes, 5 years, actually pretty much on the dot, I think today or a few days ago since my hysterectomy.
Wow. And back then, I remember, because I remember having the discussion actually with John, I know, remember talking to you about it. There weren't many women who had made that choice and had gone to those lengths. Were there? Were you were like one of the first.
You know, correct me if I'm wrong, Connie, but I think women have been having hysterectomies for gynecological issues more commonly in the past. However, in terms of for preventative reasons, when you have a BRCA mutation, yes, it's relatively, I guess, new, as you could say.
You were the pioneer in your family, as though, as
well,
we were
I was able to be the
yeah.
first one in my family to really be able to drastically reduce my cancer risk by having these surgeries.
Wow.
Yeah.
Which is so powerful.
Right.
It's certainly an option, and nowadays, and thanks in part to Angelina Jolie, we are talking about it more. I'm sure more women are looking into it and figuring out if it's right for them. But what are other options, or is that the best road?
It's an individual decision, and there are several options that should be considered before testing is even initiated. It should be discussed. The patient should be well counseled. There are risk-reducing medications, the risk-reducing surgeries like that Amy had, and there's increased surveillance for those cancers that are associated with BRCA1 and 2, being breast, ovarian, male breast, pancreatic cancer, and aggressive early prostate cancers and melanoma.
So how do you know, I mean, I would get so freaked out. I would think, all right, I just want to be tested for everything. So how do you even know if you should be getting, like you said, genetic testing, to even know if you're in this classification where this could be life-saving preventative surgery for you?
The key is identifying the families at risk. We have to identify these families. So at the Margaret Needland Breast Center, everyone who comes in for imaging is offered a risk assessment. And so we're looking for families that have early age of onset of breast cancer before the age of 50, multiple family members on the same side affected with breast cancer, ovarian cancer at any age, male breast cancer, early aggressive prostate cancers, pancreatic cancers in the family. All of these things are important, and if you're of Ashkenazi Jewish ancestry, your risk for having a gene mutation, one of the founder mutations in BRCA1 and 2, is much higher than persons who are not of Jewish ancestry.
And that was in your case,
yes,
right,
that
Amy?
was in my case. And the thing is, you may not be who you think you are. That's what another counselor always says, and it's her favorite line. But it's true, and I think you really need to just look at your own family medical history. And like Connie said, there are other methods for risk reduction. And I think the Angelina Jolie announcement really is, you have to take that as a starting point on information you can take to your doctor to discuss cancer risk and your individual cancer risk and cancer risk management. And if that means speaking to someone like Connie, if you have that gut instinct along with that family history, I think that is the best thing that you can do for your health and for your family.
Does insurance cover this kind of testing? Can anybody who has that kind of a background, who has those cancers so closely related to them, can they get the testing?
Yes, if you meet criteria for testing, which there are certain guidelines as to which families are most provocative in their histories and those that we're identifying, most of the insurance companies will cover the cost. Medicare is a little bit trickier because you have to be affected by breast cancer, male breast cancer, or ovarian cancer for them to cover it. But the labs are becoming so competitive now, I can see in the near future that the costs are going to come down and patients may choose to test out of pocket.
What about the surgeries, though? I mean, if you get to that point and then you need the surgeries, how much of that is covered? I mean, I hate to just get down to the money, but that's what everyone asked you.
You know what? You have to address the money, because that is an important question that people have. And that's why it's so important to go to a genetic counselor, though, too, because they know the protocols, the boxes to check, and how to then refer you to the correct oncologist and to get those surgeries covered. It's a really important step. I think I ended up paying, I think it was $1,800 for my double mastectomy and reconstruction, and there were a lot of zeros at the end of that, so that was a pretty good number.
Absolutely. So I was talking to you before when you were in earlier this week, and we had some people doing a web chat, women asking questions, and I know money was one of the big ones, but what were some of the other ones? And then I want to get into another topic that you were enlightening me about, Connie.
So,
What were some of the other questions, because if you all can remember some things other women really needed to answer, and I don't want to speak for them, I want you all to tell me what they need to know.
There's a little bit of confusion, and there's a little more chatter about the BRCA 1 and 2 testing that's being done today, that's being covered by insurance companies, compared to what was being covered back in 2005 and 2006. So people who were tested before 2011 and were BRCA negative, we're going to recommend that they reassess their family history with a genetic counselor so we can determine if they need more complete BRCA 1 and 2 testing. There's a little difference. We used to just sequence in the testing, and now we realize that there are some large rearrangements, some deletions and duplications in BRCA1 gene and BRCA2 gene that weren't identified by the sequencing test that was the test that was initially done.
So what, you could have been found to be
You could be negative, but actually be positive because we looked at the gene differently. And then the other big piece of that is the emerging genes. So people who have provocative family histories, and we're seeing these breast and ovarian and pancreatic cancers, they need to be reassessed because of the new genes that we're identifying.
Is that what Lynch syndrome?
Yes, yeah, we spoke about Lynch syndrome
Exactly.
briefly. With Lynch syndrome, it's endometrial cancer, ovarian cancer, and colorectal cancers, and those cancers tend to occur young. So we start screening in the 20s when it's the Lynch syndrome genes.
Does this really boil down to knowing your family history as much as possible, or are there other factors? And
Well, it's tough because there are families that fall through the cracks.
Exactly.
Families that maybe have a lot of male family members, only maybe one female that hasn't been affected. And maybe the males, maybe there's only one prostate cancer. So it can be difficult, or maybe they're small families. In my own family, my grandmother died when she was 33 years old, okay? But we didn't put the pieces of that together until my 48-year-old sister was diagnosed with both uterine and ovarian cancer, 2 separate primaries, and subsequently ended up getting genetic testing.
So what is the advice? What's the big advice that you both can give?
Gather your family history. Learn as much as you can. The hardest part of what I do is getting the information that I need. That's getting the pathology reports from all family members, the actual genetic test results of anyone who has been tested, because that's what informs my practice and how I'm going to assist the patient in testing and what genes we're looking for.
It really, you can be so empowered with this information and then make the decision that's right for you.
Don't bury your head in the sand. It's not in the best interest of your health.
All right, Amy, Connie, thank you so much.
Pleasure.
Interesting. We really appreciate all of your insight and all the help you gave our viewers earlier this week as well. Thank you.
Our pleasure.